Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we're trying to help and give infection preventionists and others on the front lines battling COVID-19 all the help that they can get. We did that last week when we wrote about a study that was published in the American Journal of Infection Control. But we weren't the only ones to write about that study. It caused quite a stir. The study says that Lysol disinfectant spray and Lysol disinfectant max cover mist are effective against SARS-CoV-2, the virus that causes COVID-19. The Environmental Protection Agency looked at the study's data and agreed. The EPA greenlighted the two products to combat COVID-19. Now, anything that's effective against the coronavirus excites not just the public, but the healthcare workers in hospitals who need to make sure that surfaces and air in hospitals are as COVID-free as possible. With me today is one of the authors of that study, Dr. Julie McKinney. Dr. McKinney is the Global Director of Microbiology and Virology at Reckitt Benckiser, the makers of Lysol products. At Reckitt Benckiser, Dr. McKinney leads a team comprising microbiologists, chemists, and consumer scientists. Dr. McKinney, thanks for being with us here today at Infection Control Today.
Thank you, Frank. I really appreciate the opportunity to come and speak with you. I'm excited to talk about this study.
Great, great. Now, everybody, and I'm sure headline writers especially, I suppose, see the study as a ringing endorsement of some Lysol products, and in a way, it is. But do the ramifications go further than just the products manufactured by your company?
Yeah, I'll answer that in two ways. First, just very simply, yes, but also just let me give you a little bit of understanding about why we conducted this particular study the way that we did. In order to get information out to the public very quickly, we compiled just a small amount of data. We're actually in the process of producing even more data around the efficacy of products against this particular virus, but we focused on a sort of a kind of an easy distribution of microbiocides that were commonly in the market, including our own, of course, and also products that we have in Europe under the product name Dettol. So we had a small collection of products we targeted first because of the restrictions and the difficulty around testing using this virus. We tried to hit different forms, and we also tried to hit upon, again, the different actives, such as quats, PCMX, salicylic acid, and ethanol. So we just tried to give a broad understanding of the things that would be efficacious. And in just understanding viruses in general, we were confident that these types of microbiocides would be efficacious, just understanding the hierarchy of susceptibility.
What made you decide to do this? I mean, you just answered what made you decide to do this. Tell me how it would work on the ground. I mean, everybody's familiar with Lysol products. It's a spray can, you spray it around.
Yeah.
But I mean, I imagine in a healthcare setting, there has to be more of a systematic approach to using it, right?
Well, that's a really great question. So our products, because they are considered pesticides, they are regulated by the EPA, and the EPA has standard methods that we use to be able to test the products in order to be able to claim a certain efficacy. This is the exact case here. There are standard methods, ASTM methods, that we used. Since this virus is a BSL level 3 virus, we did not have the facility to do the testing. We're rated up to a BSL level 2. So we have partners. Our particular partner that we used for this study was Microbac in Virginia. So they did the testing on site. We created the protocols and the testing standards and things like that, and they executed the testing. So I'd say, talking about the logistics of this, it was very difficult in the beginning because the virus was so new. Nobody had it. And so we really worked across our partnership and our network to quickly gain access to it and then be able to set up the testing because the testing did have to be under protocol because we were going to submit the information to the EPA. Everything had to be done at a very high standard. So logistically, it was quite a undertaking for the team.
I'm an infection preventionist or a nurse or a doctor. Well, I guess I don't think a doctor would be into cleaning the hospital room, or environmental services person. There was a COVID patient in the hospital room. I have the Lysol products with me. What do I do? What do I do when I go into that room?
Well, that's, again, another great question, because this product, our Lysol products, are they do meet the healthcare standard through the EPA for being able to be used in the healthcare setting, but they cannot be used on devices. That's something like a stretcher or any other type of instrument that might be used to work on a patient. So we would always recommend that you use according to the label instructions. You clean the area in advance, and then depending on if you're going to disinfect or you're going to sanitize, you would simply spray for a period of time, about 6 to 8 inches away from the area that you're trying to disinfect or sanitize. If you're going to disinfect, you're going to let it sit for 3 minutes, and then you're going to wipe it. If you're going to sanitize, you only have to leave it for 30 seconds and then wipe.
So you're talking about surface disinfection. Now, we all grew up with Lysol products, and then
Yeah.
what we do is just go into a room, just spray it around.
Yeah.
Is that how this is going to work with hospital settings, these products, or is it basically going to be surface disinfection?
It is surface disinfection. Absolutely surface disinfection.
And how often do they? I mean, you know how contagious this. I mean, everybody's been reading about it.
Yeah, and to be honest with you, we don't have any data yet to say how often you need to be sanitizing. I think that we will use currently we would recommend just basic hygiene style recommendations. Like I think about, I have small children. I would wash my hands or I would disinfect a surface after I change a baby diaper. So after something has occurred in an area, you would go in and use the product. But unfortunately, we haven't generated any data yet, and my knowledge, no one else has, as to how often you would have to, because this doesn't necessarily have a residual effect. So that would also play into the amount of time that you would have to use, or how often you would have to use the product.
Any studies in the work that you're doing?
We are not currently looking at that. The only thing that I will say, we are not currently creating studies. We are currently creating guidance for industry to use. That guidance isn't public yet, and so that's not something that I can share at this time, but we are currently compiling our data to make a recommendation.
Now, as you mentioned, your products come under the EPA. Does the CDC get involved in this anyway?
No.
So when you say surface disinfecting, are there specific items in a hospital room? I think, correct me if I'm wrong, but you said that the gurney would not be something that they would disinfect? Or?
Yeah, that would be considered a medical device. And if we, in order to have it where we could state that it would be efficacious in that situation, we would have to go through FDA approval, which we have not done. We do have an indication on the label for use on fabrics. I don't remember exactly what that particular what the time period is, but we do have an indication on the label for fabrics for Lysol disinfecting spray. I do want to be clear, there would be slightly different indications if you were using a trigger or something like that, but a Lysol disinfecting spray, the indications for disinfection and sanitation that I provided are what you will follow.
It seems like a very narrow window of surfaces that you can actually use the products on right now. Are you going to? I mean, well, is that a fair assumption? And secondary, you try expanding.
Well, and I would say that it's not necessarily narrow, because the surfaces that we're targeting are high touch surface areas. And those do tend to be hard surfaces. You're talking about something like the doorknob, the light switch, areas around the bathroom, things like that. So we are targeting the high touch surface areas, but I'll acknowledge that this is just one factor in controlling the spread of illness. There are other factors at play, obviously. Good hygiene, things like that. Isolating somebody who has an illness, that's another area where you could really break the chain of infection. But it is one tool in the toolbox that we think is very valuable for people to be aware of.
What was the biggest challenge in doing the study?
Definitely the biggest challenge was operating under pandemic lockdown conditions and trying to get access to this virus. So just thinking about logistically what was occurring during this time, we found out about the virus. The virus really, became pandemic in nature. It wasn't available for testing yet, so we had to access the virus for testing. Then we had to get our products together to be able to ship for testing. We had to be able to do protocols and things like that. And we're working on a very restricted, like basically individuals in the laboratory at this time. We're doing rotating. We can't have people in the laboratory at max capacity, but we're really, technically operating in a max capacity situation because this was so urgent. We wanted to be able to get this information out in a very timely manner so that people could use the information.
As you mentioned earlier, you're the mother of two small children.
Yeah.
Do you use Lysol products at home? That's not a loaded question since you're employed by them. You better say yes. But how do you use them at home?
Oh, well, first of all, I'll say that I came to Reckitt last September, and the number one reason I came to Reckitt was the Lysol brand and the ability to work on a brand that has such an impact on people and children in general. Just thinking again about how easily we have access to a product like Lysol, and even before I took the role, and maybe this is also what made me a good candidate, I shared that I have pocket Lysol. Anytime anybody has been sick in my home, I completely disinfect the entire area with the Lysol disinfectant spray. I'm always wiping down doorknobs, light switches, any hint of an illness, I'm cleaning the area with Lysol disinfecting spray. So I have to say it's been very exciting, again, to be a part of the company for something that I just love so much. I'll also put a plug in, just because I wasn't aware of this, Dettol, which is a product that is used mostly in Europe and Asia and countries like that. It is also a disinfection product, but those communities use it in like amazing ways. They might wash their laundry with it. They might clean their floors. They use it for everything. It has such a good, just good disinfection qualities that it's really widely used. And I was really interested in that because of the impact that having good hygiene and not having a lot of infections early on in your development, that actually it increases your likelihood to develop your brain and your entire body in to the best of its ability. So if we can break the chain of infection at a very young age and keep children healthy, their potential for growth is really astronomical. So that excites me, as you can see.
Like I said, it's a loaded question. But so I'm walking into a hospital room. I have your product. What can I spray down? The light switch you mentioned. The doorknobs you mentioned.
Yeah, doorknobs, light switches.
The window shades, the window sills.
Yeah, absolutely. The bed frame, I would say, even, think about where you might put your hand at the top of a bed frame. That, that's a plastic surface, I believe, normally in most hospitals. That area can obviously be sprayed. Also, in the bathroom area, and anywhere around the sink, we have products just specifically for the toilet, but theoretically it could also be used to spray the toilet, knowing that you would first want to, again, clean those areas because organic matter is, of course, going to impact the efficacy of the active.
What about the wheels of the hospital bed, or just?
Yeah, absolutely.
Oh, yeah.
Yeah, you could also spray the wheels as well. Yeah.
Can you spray the bed itself or no?
The bed itself, well, technically, it depends on what it's made of. Like I said, Lysol disinfecting spray does have an indication for fabrics. I'd have to go back and look to see exactly what that says. But, theoretically, that would be a fabric material, the bedspread or the mattress. But also, I think mattresses in hospitals typically have a plastic cover. So, again, that's another area you could definitely spray it down.
Did you get a lot of reaction to your to the study? And I mean, obviously, this is part of the reaction.
Yeah.
But have you been getting a lot of feedback? What kind of feedback have you been getting?
Yeah, we've been getting a lot of feedback. Because we were the first to come out with this information in a scientific forum, and also because we were the first product to gain EPA approval for use against SARS-CoV-2, we have gotten a lot of response from industry in general, because as you're probably aware at this point, everybody is going to have to increase their level of cleaning and disinfection and sanitation if they're going to have consumers come into their spaces, if it's grocery stores, if it's airplanes, whatever. So we've gotten a lot of, obviously I can't mention names, but we've gotten a lot of requests from industry to be able to help them understand how to best use the product in their environment.
You raise an interesting point, because with some of the stories I've been following, a big core of my readership are infection preventionists at hospitals, and their expertise is going to be, it looks like, used by industry. Industry's going to tap into their expertise, perhaps even hire infection preventionists at hospitals. So you're saying industry, from your point of view, is looking out also at ways to contain the infection through use of your products then, right?
Yes, absolutely, absolutely, or products of similar nature, because I do believe the way that the article was written emphasized the fact that these actives, they happen to be in our products, yes, but these actives are going to give you efficacy against this virus. So that's to me would be the big takeaway. We're not saying you have to use our product. Obviously, we would like you to use our product, but these actives, a disinfectant with these actives would provide efficacy against this virus.
So I was kind of leading to one of my questions: how proprietary is this for you? And obviously, you publish the ingredients, so anybody who can get a hold of the ingredients can create the Lysol formula in a way.
Yeah, I guess, and to be honest, there are other companies that have very similar products as well. Again, I won't name those companies or those products, but and so yeah, I think it's and also the in order to be EPA listed, you have to share the entire product formula. So all that information is available very clearly through the EPA website.
I know 3M, the manufacturer of N95 masks, have made it a point of saying that they're not raising the price of N95 masks as
Mm-hmm.
part of the demand, part of their effort to be a good citizen during
Mm-hmm.
this uh, pandemic. And I guess it's another softball question for you, but
Yeah.
I guess Lysol feels that perhaps this is their way of contributing.
Yeah, absolutely. That's really a kind of a good lead in to, I think, why the study also occurred. It's because knowing our level of expertise in the hygiene area, this was a way that we could contribute in a very meaningful way. The company takes it very seriously. You know, their mission is to protect and heal consumers, you know, through products like this. One of the biggest ways that we can do that, we obviously have other products, but through stopping illness-causing germs. I mean, that's what the company does. We want to improve communities, improve lives through the products that we create, which happen to be, you know, germ destroying products.
Has anybody challenged your findings?
No, no, and no, not at this point. No.
Any kind of, I mean, any kind of negative feedback?
No, we haven't. No, we haven't. The seal of approval from the EPA pretty much says, okay, that it's what you say it is, and that's the seal of approval. You know, they've reviewed the data. We've used a standardized method, so yeah.
And you say, for your part, specifically, there's no studies in the works at the moment to further look at this.
Well, we do actually have not exactly the type of study that you mentioned, but we have additional studies that have expanded the product range that we're including to show efficacy against the virus. That publication, we are preparing it right now. It is going to be a larger publication. We went in as a letter to the editor because we wanted the information to get out there quickly. We could have just broadcasted it, you know, through commercial or consumer outlets, but we really felt like it was important to put it into a peer review space in order to increase the credibility of it. So we do have a larger publication coming out where this information and much more will be added. We hope to get that into the publication queue by the end of August. I feel confident that we're going to be able to make that. As far as when it will actually hit, you know, the peer review space, they've been expediting studies like this, so I'd feel confident that by the end of the year we'll definitely see an expanded article.
And finally, any words of advice for infection preventionists, nurses, environmental services people, sterile disinfecting teams, procurement teams, supply teams, food service workers, all the people that are working in hospitals these days? Any final words of advice about how they should approach these products and approach cleaning with these products in particular?
Again, another great question. I would just emphasize, you know, what we're trying to do is we're trying to break the chain of infection by interventions such as disinfectants and sanitizers. This is one piece of the puzzle. You know, proper hygiene is another incredibly big part of that. Wash your hands, wash them often, basic things like that. So think about it as more of a holistic approach. You're not just going to use a disinfectant or a sanitizer. You're going to use other approaches to be able to ensure that you break that chain of infection.
Dr. Julie McKinney, thank you so much for stopping by on Infection
Okay.
Control today, and good luck with everything, especially minding two small children who are
Yeah.
locked down. I'm sure that has its own challenges. But again, thank you for visiting us today.
Okay, great. Thank you.